Mm. Mm. Yo.
So, good evening everyone. As you see in that patient, so he is having severe hemoptysis. So today we'll discuss about something called interesting disease called hemoptysis. So there is a huge confusion behind what is meant by hemoptysis and what is meant by hematemesis. So the hematemesis means we have to blood vomiting. So this is called an hematemesis, and hemoptysis means spitting of the blood to the cup. So this is called as hemoptysis. So this is very important, and it is to be diagnosed very early, and treatment should be taken very early, as it is having a serious life-threatening problem. It is to be taken seriously. And today we'll discuss whole and soul about this hemoptysis. So he is a 45-year male patient. Today he presented admitted for mild he was having mild chest pain and everything. So because of this, we gone for the ECG, and ECG shows of acute anterolateral wall MI. So this MI thing we'll discuss later, but only for this bleeding, whatever hemoptysis is, no, we'll discuss about that. So what is meant by hemoptysis? Hemoptysis is nothing but a spitting of blood through the where actually spitting of blood is called as hemoptysis. Vomiting of blood is called hematemesis. In this patient, we have spitting of blood during the cough. It is called a hemoptysis. So, in which all are the conditions that will cause an hemoptysis? 90%, like in India, most of the causes of hemoptysis include only tuberculosis. Usually in India, because all of the patient is mostly other than normal, only hemoptysis 60 to 70% of the cases that is directly goes towards the tuberculosis. Because of the TB only, they will split the blood. And one more thing, we will discuss whole and soul. What are the causes of the hematemesis? So causes of the hematemesis includes so many conditions. Either it may be a pneumonia, bronchiectasis, bronchiectasis. So actually, this all is mild. There are some patients who are already in ecosprin tablet, who are already taking blood thinner medicines, and that patient is already having tuberculosis. Because of this chronic coughing, because of blood already in the medicines, they may split the blood. In this patient, so he is a TB patient. He is the third month of AKT, and his X-ray shows of multiple cavitatory lesions. So because of his TB condition, there is a cavity. So this bleeding from that cavity is coming because of the. As a patient, we have treated him for the. We have done thrombolysis now. Thrombolysis is streptokinase. We know the streptokinase will cause severe bleeding. So as the patient, we are treating for the MI. We are thrombolysing, but because of side effect, it may cause them bleeding. So as this patient, he have got bleeding from this lung. You can see the sound. So bleeding from this lung tissue. So only thing is hemoptysis is nothing but it is coming from the airway. It is come from what are the airway, like trachea to lung. It may be from the trachea, from the vessels of the trachea. Either it may be lung parenchymal conditions. So what are the lung parenchymal conditions? Like lung parenchymal condition that may cause hemoptysis includes first one is TB, that is because of the lung parenchymal involvement. Either TB patient will have some cavitative lesions in their lungs, because of that may cause some bleeding. And one more thing is patient is having severe pneumonia, and patient is having known as COPD and emphysema patient. Because of this, all this COPD emphysema, they are already in breathlessness. They will be having in continuously chronic cough. As the patient undergone any thrombolysis or any IHV patient, they may be in ecosprin therapy. They may go because of this condition, adverse effect or the side effect, it will cause an hemoptysis. So one more condition is there are some unknown, like only there are so many conditions, but for practical purpose we'll divide it into some that hemoptysis with serious condition, hemoptysis with normal condition. Means hemoptysis of life-threatening and hemoptysis of normal, like it may be divided into either it may be classified into on the quantity of the hemoptysis or the severity of the hemoptysis. It is called as mild hemoptysis when the hemoptysis quantity, the amount of blood coming spitting is less than 30 ml. If it is less than 30 ml, it is called mild. If it is 30 to 60 ml or 100 ml, it is called as moderate. More than 100, around 200 is called as severe or life-threatening. So what is meant by life-threatening bleeding, or why it will cause life-threatening? Because as we know that there is cough, that blood is coming from the airway. and the trachea, as the patient is having more quantity, in only single bout. So only one more thing is, in single bout, how much blood it is coming, that is also very matter about. In some patient, they will come out around 30 to 40 ml per bout. It is very, very life threatening. They will definitely gone for the respiratory failure, as the patient is having bleeding through the trachea, or as a person is spitting and this bleeding is having, there may be chances of clot formation in between the trachea, because whatever the spitting, the haemoptysis, that continuously, that adversely affected and trapped into the trachea. Because of this blockage in the trachea, the patient will directly go towards the, it may very, very seriously, it may life-threatening condition may happen. So this quantity depending upon the whether mild, moderate and life-threatening. Mild means less than 30 ml, moderate means 30 to 60 or 100 ml, or severity means 100 to 150 or 200 ml. So anything more than 150 is very, very dangerous, because definitely as the patient is having splitting the blood, it will clot and it will block the trachea and patient will die. So this is the condition. In this condition, what we have to do? We have to think. There are some patients. This is some. This patient is very serious, and we will discuss some non-serious conditions, like patient is having a bleeding condition minimal, without any danger signs. Means patient is only mild bleeding. When the patient is clot, only one to two drops of blood came, or the sputum mixed with mild redness. If it is, that means what we have to do? In OPD wise, any patient come to, like, doctor, I got in morning during brush, I got vomiting, I got spitting that may contain some red colors, spitting was there. So in this condition, what we have to do? We have to see, is it only once or it is occurring daily? And is he having history of any tuberculosis? Is he having history of cough, cold, fever? If it is having cough, cold, fever with only one quantity, it may be, most probably it may be because of the lower pneumonia, lower respiratory tract infection. So that's why what you have to do, orally higher antibiotics to be given and to be sent for home. If it is having, if the one more patient came and probably, doctor, during brushing I got cough, during cough I got more like 5 to 10 ml blood came. It is happening since 2 to 3 days. Yes, since 2 to 3 days it is happening. Means we have to see whether is he having any cardinal symptom of PTB. What is meant by cardinal symptom of TB? Either it may be having daily evening rays of fever, anorexia or weight loss, any other myalgia, weakness, all the, if it is there, means we have to directly think it may be a tuberculosis. As the patient is having mild, severe quantity, it may be a tuberculosis. Yes, what you directly advise an X-ray. X-ray have to say, X-ray if it is normal, we have to give an admission, we have to admit the patient and give higher antibiotics, and you have to wait and watch. If the patient is having same complaints, and if the patient is having more quantity, or if the patient is having same complaints, X-ray shows of some cavitary lesions or any consolidation, that TB like symptom, it definitely to be treated for the tuberculosis and should be treated accordingly. And this is one OPD wise. Now I am discussing massive haemoptysis. What is meant by massive haemoptysis? If the patient is having huge quantity, suddenly during suddenly cough started and I vomited this much. So around the patient will show this much vomiting. Around it may be 1 glass, half glass, 1 glass. This to be measured. If it is there, means we have to take urgent intervention, because it will very, very danger condition. It will cause death at any time. So how to manage? If it is OPD wise, only patient for management or treatment purpose. If it is a OPD wise, we have to give advice only once, only one time. If it means we have to give higher antibiotic, treat as in a lower pneumonia, like lower respiratory tract infection, like pneumonia have to be treated. If it is not treated, then you have to admit and see for the chest X-ray. If chest X-ray normal, we have to use normal antibiotics and higher antibiotics. After that, we have to wait and watch. If it is, there are some non-tubercular haemoptysis. What is meant by non-tubercular haemoptysis? TB is not there, but still patient is having huge bleeding. So it may be because of any malignant conditions, any tumor condition, or any lung malignancy. So lung malignancy is a very dangerous condition. If the patient is having more than 50 years and the patient is having a severe haemoptysis, like more than 50 ml, 100 ml is there, means we have to take CT scan, HRCT to be advised, and if it is a shows of any malignancy, to be referred for the cancer hospital for further investigation. So this is some haemoptysis management. Only management, you have to take the airway breathing circulation to be taken. If it is bleeding, we have to stop the bleeding by tranexamic acid, and there are some conditions like if the patient is having more than 100 ml vomiting, we have to go for the single lung ventilation by intubation. So this is very tricky, and single lung ventilation is not available in every ICU. So in high-tech ICU, there will be a chance, there will be availability of single lung ventilation. And if it is a bronchoscopy, to be advised after the stop. If it is bronchoscopy, any blood vessels means tear, means we have to ligate them blood vessels. Only if it is a tracheal causes any blood disorder, we have to ligate. If the lung causes, we have to treat accordingly. So this is hemoptysis. Thank you.